Okay, today we're going to talk about, in veterinary terms, anesthesia and fluids. Now, we've talked about anesthesia before, not so much about the fluids that we give, but we're going to really dial in now on some of the terms that you really need to pay attention to. So, anesthesia is the total loss of sensation in a body, either part, which is local anesthesia, or in the entire body, which is general anesthesia. And this is resulting from the administration of an agent that depresses the activity of the nervous system. There are different forms of anesthesia. Local is loss of sensation in a small area of the body produced by administration of a local anesthetic agent in proximity to the area of interest or the surgical area. Also, when a drug is injected around or in a nerve or nerve ending, we can get a really focalized area. Regional is when loss of sensation in a small area of the body is produced by administration of a local anesthetic in proximity to the area of interest occurs. So we can get local or regional anesthesia typically by using something like lidocaine. You've probably heard of lidocaine or novocaine before. This is something that deadens nerves in a certain area. Um, for general anesthesia, this is a reversible, should be a reversible, state of unconsciousness, immobility, muscle relaxation, and a general loss of sensation throughout the entire body produced by administration of one or more anesthetic agents, typically more than one. General anesthesia has to do with really shutting down the central nervous system, primarily the brain. So we are looking for a surgical form of anesthesia. This is a specific stage and plane of general anesthesia. And if you'll remember, it's stage 3, plane 3, in which we have a sufficient degree of analgesia, which is pain relief, and muscle relaxation to allow the surgery to be performed without pain or movement. Balanced is how we administer multiple drugs concurrently in smaller quantities. It allows us to give drugs at a smaller dose than it would be required if each were to be given alone. It produces sedation, tranquilization, muscle relaxation, analgesia, and a variety of other effects needed for a particular patient. It's kind of like when you make a recipe at home. If you just add salt to the recipe, it's going to not produce the same taste as if you were to add salt with some pepper, with some garlic, etc. We don't have to use as much of something to get the taste that we need. So we want to balance the drugs as well. Each one is going to add a little bit of something extra. Dissociative is when we have a combination of tranquilizers and opioids. It induces general anesthesia, and we use it in a wide variety of species. We call it a dissociative because it dissociates various regions of the brain from the body. So the animal may appear awake, but they're immobile and unaware of their surroundings. So their eyes will be open, but they really don't know what's going on. They could be able to feel pain but not respond to it, which is not something we really want. We do not want them to feel pain. We really want them to not feel pain. So opioids will help with that, and the stronger the opioid, the better. And there are certain tranquilizers that we can use if we use them appropriately that will cause muscle relaxation and pain relief, as well as tranquilization. So dissociatives are commonly used, and because a lot of them can be reversed, but we definitely want to make sure it has some pain relief in there. Akinesia is the absence of movement. It's the temporary paralysis of muscles by the administration of an agent that blocks sensory or motor nerves. So akinesia is the animal cannot move. It's not appropriate to use an akinesic uh, method without any pain relief. And it used to be used fairly often in animals because people didn't believe that animals could feel pain. They just wanted them to stop moving. So analgesia is the absence of pain. It's what we really want to focus on. We would love to do it without a loss of consciousness, but sometimes we need to break that, depending on the level of pain, we need to break that perception of pain as well. Uh, and unless it's associated with surgery, loss of consciousness and pain can be, um, it, well, if it's surgery, loss of consciousness and pain is good management. So we do want, for the most part, our analgesia to be um, pain without the loss of pain without the loss of consciousness, unless it's surgery. Catalepsy. Catalepsy is a word that refers to the condition of diminished responsiveness, usually characterized by trance-like states and stiff, not stuff, but stiff limbs. Patients remain in position they are placed, and the brain is just disconnected from the body. Again, with akinesia and catalepsy, we really want there is some awareness there. So we really want some pain relief along with that. It's not appropriate to just use those products. Hypnosis is what we talk about when we are inducing sleep, but hypnosis is different from sleep. Hypnosis, these animals can be roused with a painful stimulus fairly easily. So we do want to be really careful if we're inducing sleep through a form of hypnosis, and it can be drug related, or in the case of rabbits, we can actually put them on their back and stroke their bellies. And if we do it enough, they will go into a hypnotic state. So, but if we're doing something painful, we want to make sure that we have pain relief going with that. Narcosis is a condition caused by drugs causing nonspecific and reversible depression of function of the central nervous system marked by stupor. So here's a little picture of a puppy with a cocktail uh, used as a narcotic. It might act a little funny, okay, but really sleepy. Sedation is a production of calming. We want to remove excitement. Sedation is a good way to do pre-medications so that when we do give them a tranquilizer, an opioid, something that will put them into a different state of consciousness, they will be able to receive that better. Stupor is when we have partial or nearly complete unconsciousness characterized by responding only to vigorous stimulation. So a very painful stimulus. A tranquilizer is the removal of anxiety and fear. We can't use tranquilizer and sedation within the same sentence because they're not the same thing. A sedation is calming to remove excitement. Tranquilizer is to remove anxiety and fear. So they are not interchangeable. Tranquilizers tend to be a little bit stronger than sedatives. Okay, moving on to fluid therapy. There are many different types of fluids, and you will see a lot of different names for fluids. So it's important to have a basic understanding so that when somebody says, I need normal saline, you'll know that normal saline is 0.9% sodium chloride. Okay, so crystalloids. Crystalloids are what you typically see as being given as fluids in the veterinary practice or in the hospital for that matter. There are things like lactated Ringer solution, Normasol, 0.9% sodium chloride, or what we call normal saline, um, uh, dextrose solution. Crystalloids contain crystals, okay, but they're typically electrolyte type crystals they're replacement fluids. So if we're losing fluids, we're becoming dehydrated, these are fluids that will help to replace the normal fluids within our intravascular system. Colloids, and then they will crystalloids will come from our vessels and be passed along through our tissues pretty easily. Colloids are different. These are products like hetastarch. They have really big glucose molecules or starch molecules within the fluids so that when you give them IV, they can't pass through the vessels and get into the tissues. They stay within the vascular system because they have fluid, part of the fluids are just too big. They hold the fluid within them, which is really good if you need to put more fluid into the vascular system, but not necessarily good if you need to put fluids throughout the body. So crystalloids, colloids, mostly used in severe cases and for very short periods of time. Blood and blood products are natural colloids. They are designed to stay within the vascular system, often contain plasma, red blood cells. Oxyglobin is a blood product that has oxygen carrying capability. So there's crystalloid. The difference between crystalloids, colloids, and blood products is something that you need to understand. So here's some examples of crystalloids: Normasol R, lactated ringers, 0.9% saline, 5% dextrose in water, 0.45% sodium chloride with 2.5% dextrose. So that's half strength of saline and dextrose, and then hypertonic saline, which is a higher percentage of saline. Hypertonic saline will tend to draw fluids from the tissues into the blood vessels. Colloids, like vet starch, fresh frozen plasma, so this is a blood product, frozen plasma, oxyglobin, and human albumin. Again, those are things that are designed to stay in the vascular system. So all of these crystalloids, they are made differently, and each animal that is sick with an individual animal that has an individual disease, we have to look at the disease and figure out what's going on with them before we choose the appropriate fluid. So crystalloid is a substance which in solution passes readily through animal membranes and diffuses from the intravascular space. So it goes from your IV into the tissues pretty easily. If we're going to use it to replace blood volume, so they're losing blood and we need to give them a fair amount of fluids then in order to replace that blood volume, it's 3-to-1 ratio of crystalloid to blood volume. So for every unit of blood, we'll have to give 3 units of fluid. But it is the most common form of fluids given in the hospital. Colloids are artificial fluids. The molecules are larger than crystalloids, but not large enough to settle out solution under the influence of gravity. So you're not going to see crystalloids settling out. They should stay within the fluids, distributed within the fluid. It resists diffusion, so it attracts water from the tissues or fluids from the tissues and keeps it in the blood vessels. It provides oncotic pressure. It's the osmotic pressure due to the presence of colloids in the solution, which are starches and proteins. It's confined to the intravascular space. It's really important that we don't continue to have an active bleeding issue when we're giving colloids, because if the animal is still actively bleeding, the colloids will get outside of the intravascular space and draw all the fluid with it. So it will make that bleeding much worse. Colloids are used to replace blood at a 1-to-1 ratio. Blood and blood products, 1 ml of whole blood, so a ml, a small amount per pound, raises the PCV by 1%. So you want your donor dog to be about 40% or above. But if you have a dog that needs red blood cells, and we typically say they need a blood transfusion at about 11% PCV, so we're going to give at 11%, we need to raise it to 35% if it's a 10-pound dog. We need to give, if it's 1 ml per pound, we need 10 mils for each percent, which means we want to get it up to 35%, we need to give 350 mLs of whole blood. But we can't always give that much. So blood volume is estimated about 8% of body weight. So if you have if you have a 40 ml per pound dog and you have a 10-pound dog, their whole blood volume is 400 mLs. So if we need to replace with 350 mLs, we may not get to 35% PCV. We may have to be satisfied with a 12, 13, 14% PCV and hope that their body will kick in the rest at some point. Replacement for blood loss, crystalloids 3-to-1, so 3 mils for every 1 mil of blood loss. Colloids is 1 mil for every 1 mil of blood loss. And then blood products is 1 mil for 1 mil. And that's it for anesthesia fluids, that kind of thing. If you have any questions, let's talk about it. If you're seeing something in your clinics, this is the time that we want to talk about it and kind of discuss what you're seeing and what questions you have.